Hey everybody, it's Dr. Galvin with another post-ER COVID update. Continues to be trying times in the emergency department. Lots of cases. We're seeing, sick COVID people all the time. We're able to send people home. We're sending people home now that I would have never sent home before. People with lots of medical problems that are at high risk, but if their oxygen saturations are above 90% without an oxygen requirement and they're not short of breath, we just don't have any place to put them. There are no COVID beds anywhere in the region. We've got people waiting 100 hours plus for a bed, for a COVID bed in our emergency department. So we're seeing lots of COVID, and we are sending more and more people home. And we know that a percentage of those people are going to kind of come back because they are going to get worse, but we're doing the best that we can. Want to quickly talk a little bit about vaccine update. We've got now Moderna approved along with the Pfizer vaccine. These are both mRNA vaccines. I've heard a lot of posts from people about these, I'm not going to get a vaccine. And, it's interesting because there are people in our community that, rail against masks, rail against social distancing, any type of restriction at all. They refuse to follow. And now those same people are posting all this, I won't get vaccinated stuff. So, give me a break. Someone explain to me, please. If you're not going to follow any of the restrictions and you refuse to get vaccinated, are you giving us any solutions for the problems that we're having, this full emergency department? Come on, folks, give us a little bit of a hand here. We are trying to help you. Just please, So anyway, don't get me started. I'm a little punchy. I'm a little tired, and I apologize. But it's getting crazy, and we still have people that deny that this is even going on, and it blows my mind. Regardless, let's talk about these vaccines. Are they safe or not? The preliminary data is very good. And these mRNA vaccines in particular are really pretty benign because all they're doing is sending an instruction to these protein factories in your cell to produce this viral spike protein that your body then recognizes as being foreign and makes it an immune response to it. It doesn't go in and change your DNA. The mRNA does not go into the nucleus, and it's very short-lived. It's very unstable. That's why it has to be kept at such cold temperature. So it's only in your body for a day or two, then it's gone. So the chance for long-term side effects are slim. There's been a lot of talk about these allergic reactions. Oh my gosh, allergic reactions. I'm an ER doctor. Do you know how many allergic reactions I take care of a year? People have allergic reactions from insect bites, from eating shrimp, from makeup. For us, an allergic reaction is not a big deal. I think I've seen one or two massive allergic reactions that have led to death in my entire 20 plus year emergency medicine career. We are very good at taking care of allergic reactions. It's very simple. And so I'm not really worried about allergic reactions. They're going to happen. It just is. Bell's palsy, which is a little neurologic deficit where you get a little facial droop, happens in a very small percentage of people. It's temporary, short-lived. It will go away. None of these things really particularly bother me. I am waiting to get signed up for my immunization. I haven't. I'd like to come to this hospital because we're going to have the Moderna vaccine. The Moderna one has, it's preliminary data, but, also besides being protective at 94% or so, also in the Moderna trials, they did not have anybody that got vaccinated develop severe COVID. They had some mild COVID cases develop, but no severe COVID. So the Moderna one, in my mind, may be the one that's a little bit better. There are other ones coming. They may be better than these. It's a mixed blessing. Many of you are not going to be eligible to get vaccinated for some time. That actually may be a good thing because there may be a more effective one available a few months from now. It does look like they're starting to talk about who would be the second wave of people. And these are going to probably be essential workers, police, fire, teachers. We can get, kids are low risk. If we get teachers safe, then getting kids back to school is going to be a lot easier. And those over 75 will probably be in the second wave. And, I don't know when that's going to happen, but that's probably likely what's going to happen. Now, I want to quickly talk, we've got Christmas coming up, and listen, we need to be safe for Christmas, but I'm not an idiot. Most people have got plans to see family. This is the first time in 23 years we are not actually going to be with family other than my immediate family. This is, because of the virus, and I'm trying to set a good example. My children, who are 23, 21, and 19, are strangely excited about it because we've never ever had a Christmas just ourselves. We are going to be Zooming with our family up in Syracuse and in New York City and other places, but that's what we're going to do. But I know a lot of you are going to travel. So what can we do to minimize risk? Well, first of all, look at your own personal risk. Have you been exposed in the last 14 days to somebody with COVID? If you have, you probably shouldn't be around other people. If you have any COVID symptoms, fever, cough, the typical things we've been talking about forever, you probably shouldn't participate. If you're waiting for your test results, you probably should distance and wear a mask while you're around other people until you know for sure. And those people that are high risk, people with immune compromise, diabetes, obesity, hypertension, heart disease, older people, we know mortality goes up the older you are. It's really important that we protect those vulnerable segments as much as possible. If you are having a gathering of your family members, know what the rates are of spread in your community. If you're in a community that's experiencing very, very high transmission rates and high rates of COVID infection, then you might want to reconsider what you're doing. If you can be outdoors, now it's wintertime, but there are lots of areas of the country where you can have events outdoors, and the more ventilation, the better. So everything you do to provide good ventilation. Obviously, larger gatherings are riskier. We want to try to, as much as possible, when you're in the house, distance as much as possible. Longer gatherings, I think my biggest concern about Christmas is the length of the holiday. We saw a huge spike after Thanksgiving, and most people go, a lot of people go for Thanksgiving dinner and they're done, and we had a huge spike. Most people for Christmas, oftentimes spend extended periods of time, and we've seen time and time again in my practice, in my friends group, that it is extremely, extremely contagious. And if you're in a house with somebody that has COVID for more than a few days, it's very likely everybody in the house has got COVID. So shortening the duration, perhaps staying at a hotel as opposed to staying at the house might be a good idea. If you're traveling, if you're in a train or a plane or like in a big crowd, that might put you at increased risk. So those are things to think about. I understand we all want to celebrate the holidays, but this is a very dangerous time. I am very, very, after seeing what happened 2 weeks after Thanksgiving, I can only imagine what 2 weeks after Christmas is going to look like. So please protect yourselves. Do everything you can. Don't inadvertently, get somebody in your family extremely sick, especially grandmother or someone who's older or chronically ill or at higher risk. Just, it's 1 year. We can temporize for a year. With everything that's going on, hopefully by next Christmas we'll be more able to have a normal time. I'm going to end it here. Please subscribe if you like my videos. Check out our website if you have interest in optimizing your health or improving your performance. That's what I do in my day job when I'm not working in the emergency department. Like us and follow us on Facebook. Stay safe. Merry Christmas. Wash your hands. Wear those masks. Look after yourselves, your families, and your neighbors. Good night. I will talk to you soon.